dyspepsia or indigestion. It consists of a group of symptoms which are originating in the GI tract and also in the adjacent organs in the abdominal cavity. There is upper abdominal burning, hot burning, there is bloating, belching, pain in the epigastrium, then there is nausea, vomiting. These are all complaints which are narrated by the patient suffering from dyspepsia. It is of two types: organic, when there is a certain pathology in the GI tract, whether it is in the esophagus, stomach, small intestine or the large gut. While the functional dyspepsia, there is no evident pathology in GIT or in the adjacent organs of the abdominal cavity. So mostly the investigations and the treatment is done for the organic dyspepsia, while the functional dyspepsia is also termed as non-ulcering dyspepsia. So the etiology of the dyspepsia or the organic dyspepsia starts from the esophagus. There is inflammation of the in the esophageal pipe, and there is also regurgitation of the stomach contents, acidic one, into the esophagus due to the weakness of the lower esophageal sphincter, which is dilated one, and there is contraction of the muscles of the stomach as well as abdominal cavity intercostal muscles, and there is regurgitation of the gastric content which are mainly acidic into the esophagus, that producing epigastric pain and bloating, burning in the upper abdominal area. Then there is gastritis, which may be due to gastric ulcer, peptic ulcer, duodenal ulcer, gastric ulcer, maybe in advanced cases gastric carcinoma, while in the small intestine there is colorectal carcinoma is also responsible for production of these group of symptoms, which is termed as dyspepsia, or in general language of the patient, that is the indigestion. So these are the various factors which produces this symptoms or group of symptoms. But in addition to GI tract pathology, the adjacent organs suffering from, there is pancreatitis, cholecystitis, hepatitis due to hepatitis B, C, or the cirrhosis of the liver, that also produces this group of symptoms, that is the organic dyspepsia. So these are the mainly the troubles and the sufferings which are related by the history of the patient. But in advanced cases, which is called as alarm symptoms of the disease, in which there is hematemesis, there is melena, there is iron deficiency anemia, there is vitamin B12 anemia. These are the various complications or in the advanced cases of the dyspepsia. So these produces the critical state, and next is we also